Well, hi there. Today's presentation will focus on a new technology called 4D ultrasound. So what is 4D ultrasound? 4D ultrasound scans are moving 3D images of the internal body where time is the fourth dimension. An ultrasound is created by using reflected sound waves sent by a transducer. With 2D ultrasounds, the sound waves are directed to the intended area, while in 4D ultrasound the waves are sent in various angles. Here is an example of a 4D ultrasound of the fetus compared to the traditional 2D ultrasound. It is clear that 4D imaging provides much more detail than the standard ultrasound imaging, and thus the use of 4D imaging is becoming increasingly important, particularly in pregnancy. So why is 4D ultrasound important? Well, 4D ultrasound is important for the diagnosis of various conditions such as abnormalities of the uterus, location of cysts, and investigation of miscarriages. It also allows for better viewing of the baby's motion and behavior, the surface anatomy of the baby, and any problems related to a woman's uterus and ovaries. All of these things are better viewed on a 4D ultrasound machine than the traditional 2D machines. Further, surface rendered images can display anatomical structures in 3D and thus providing greater delineation, greater visual detail of any internal lesions, and it can also demonstrate the nature of cavities, thus overall providing greater clarity than 2D images. Moreover, 3D colored Doppler imaging is able to show blood flow within tissues. This ability to show vascularity of tissues is significant for the assessment and diagnosis of disease and high-risk pathological changes in an individual. Here are some applications of 4D ultrasound that can be applied in the clinic. So the areas include obstetrics, gynecology, neurological disorders, and cardiology.
Some of the pros for 4D ultrasound including allowing for the display of fetuses in real time. Some of these features include facial expressions such as grimacing, breathing, mastication. Unlike 2D ultrasound, 4D ultrasound can display more detail, which is generally more useful in a clinical setting. This can be particularly helpful during pregnancy, especially if abnormalities occur during development. An example of this would be cerebral palsy. Most children are clinically diagnosed with cerebral palsy by the age of 2 to 3 years of age, when the fetus has had sufficient time to develop. 4D ultrasounds are able to pinpoint during what trimester the baby starts to develop certain symptoms. An example of this would be when the baby is 6 months old, the fetus generally may exhibit upper extremity disorders and oculomotor ailments. When the baby is around 12 months old, further severe motor and speech impediments may arise. 4D ultrasound can easily distinguish between the facial expressions of a healthy and an unhealthy baby, simply from the facial expressions from an early age. This can be conducted through a neurological screening test called Wolf antenatal neurological test, or CANET for short, which is aimed for the evaluation of fetal movement and behavioral patterns, especially ones that can estimate the development of the central nervous system of a developing fetus. This picture here we have is just an exhibition of the CANET system, wherein facial movements such as head flexion, extension, mouth opening, closing, hand to face movements through their thumb positioning, the finger movements, and also their tongue expulsions are all parameters taken into account when screening babies using this system. Some of the cons for the ultrasound can be quickly explained through this short video here.
Hi Julia.
Hi Peter.
Is it safe to use ultrasound scans?
Compared with other diagnostic tools like CT scans and X-rays, ultrasound is considered safe and produces no side effects.
Is ultrasound risky for the developing fetus?
It is unknown safety risk. One way to lower potential risk is to minimize exposure time and intensity. Also avoid Doppler ultrasound if possible, especially early in pregnancy.
Okay.
I recommend you to visit ultrasoundtechniciancenter.org to learn more about risks, benefits and future of ultrasound.
Thank you. I'm going to visit ultrasoundtechniciancenter.org now.
The somewhat unknowns also are involved for the ultrasound are that it is only within the last few years that 4D ultrasounds have been brought into mainstream media, and while its direct effects are still vague, by extension these effects are similar to those experienced by patients who have also undertaken 3D ultrasound. One of these effects would be keepsaking ultrasounds. This implies that at times parents may be guilty of taking one too many trips to the sonographer, and unless this need is warranted, the extra exposure can place the baby at further risk. Another of these cons for ultrasound would be costs, and this simply put is generally attributed to the cost to buy and build equipment to run ultrasound, and also the cost towards the taxpayer depending on their health insurance cover.
So, as you've heard, 4D ultrasound has both beneficial and non-beneficial aspects. From being able to see in real time how a baby is doing in the womb, to it still being a new technology that has not been properly explored yet. We have seen that this technology can be applied to a wide variety of medical streams, and that it has a very low damaging rate to the human body. Since this is a new technology, it allows it to have the possibility of applying it to other services so that disease or any other abnormalities can be detected at an earlier stage, allowing the patient to have a high success rate to overcome these issues. As you can see in the slide, we have listed some future uses of 4D ultrasound for you. Enjoy. Thank you guys for listening. Bye.